All right, let's dive in. Today, we're cracking a code that, let's be honest, can feel pretty intimidating. The language of medicine. But here's the secret. It's not really a language. It's a system. And by the end of this, you'll be able to see right through it. So, let's get started. You've totally been there, right? You're sitting in the doctor's office, you're nodding along, but inside your head you're thinking, what on earth does hypertension actually mean? Or what's an appendectomy? It's a super common feeling, but I promise you that confusion is about to end. See, what seems like this complex foreign language is really just a simple code built from a few reusable parts. Think of this explainer as your own personal decoder ring. Let me show you exactly how it works. So, what is the secret key I'm talking about? Well, it's a simple three-part formula that unlocks, pretty much the vast majority of medical terms out there. And once you see it, you're going to see it everywhere. Here it is. This is the whole shebang. Almost every medical term you'll encounter is built with these three parts. First up, you've got the prefix, which tells you things like location, size, or time. Then, in the middle, you have the root. That's the main meaning, usually part of the body. And you finish it off with the suffix, which describes a condition or a procedure. Okay, let's put it into practice. Let's take a word like hypothermia. Hypo, that means below. Therm is our root word, and it means heat. And aya is a suffix that just means a condition of. So, put it all together, a condition of below normal heat. See? Simple. The code is already starting to feel a lot less cryptic. Now that you've got the basic formula down, let's start filling up your mental toolkit. We're going to run through some of the most common prefixes and suffixes you'll see, so you can start decoding these terms on the fly. Okay, here's a great little hack. Learn the prefixes in pairs. Hyper always means something is above or high, while its total opposite, hypo, means below or low. So when you hear hypertension, you know it's high blood pressure. See the word hypoglycemia? That's low blood sugar. Learning one helps you remember the other. It's a 2-for-1 deal. And guess what? This works for speed too. Tachy means fast, and brady means slow. Now the root word here is cardia, which is just Greek for heart. So tachycardia, that's a fast heartbeat. Bradycardia, you already know, it's a slow one. Once you see this pattern, you'll find it everywhere. Think of these next prefixes as a kind of GPS for the body. Supra means above. Peri means around. Endo tells you something is inside, retro means it's behind, and trans means it goes across. These little words give you the exact coordinates for where to look in the body. Prefixes also tell you about size and number, which is super helpful. Macro means large, and micro means, well, small. For numbers, it's pretty straightforward. Mono for 1, bi for 2, and poly for many. So if you hear about a polycystic kidney, you immediately know it's a kidney with many cysts. It's all right there in the word. All right, let's flip to the end of the word, the suffix. This part tells you what's actually going on. Probably the most common one you'll hear is itis, which just means inflammation. So, tonsillitis is simply an inflammation of your tonsils. Another huge one is pathy, which means disease. So neuropathy, that's a disease of the nerves. These endings are the real clues to what's happening. Suffixes can also tell you about an action or a procedure, basically what's being done. An ectomy is the surgical removal of something, so an appendectomy is the removal of the appendix. A scopy is a visual exam, like a colonoscopy. So the suffix is like the verb in the sentence. It tells you the action. Okay, decoding the words is step 1, and it's a huge step, but the code of medicine isn't just about single words. It's also about how you communicate. There are a few simple logical rules for how these words are put together to make sure everything is crystal clear. In medicine, clarity is everything. There's no room for guesswork, which is why the active voice is so important. Saying the treatment was administered is kind of vague. Who did it? Clear communication gets right to the point. The nurse administered the treatment. No ambiguity, no confusion. And it's the same idea with being concise. You've got to cut out the filler. Admitted to the hospital for the purpose of undergoing tests, that just becomes admitted for tests. It cuts through all the noise and gets straight to what matters. Every single word counts. So really, it all boils down to a few basic principles. Be direct, be consistent, and always define what you mean if it's complicated. It's a system designed from the ground up for maximum clarity, removing any chance for misunderstanding. Okay, so let's pull all these different threads together. We've seen how individual words are built logically. And we've seen how sentences are structured for maximum clarity. And this logic, it scales up to how all medical information is organized. This same logic actually shapes the entire medical story. It almost always follows this clear, simple flow. First, you get the diagnosis. What's the problem? Next, the treatment plan. Okay, what are we going to do about it? And finally, the prognosis. What do we expect to happen? It's a narrative with a clear beginning, middle, and end. So, let's do a quick recap of the code. Number 1, medical terms are just a formula. Prefix, root, suffix. Number 2, clear communication is always active and to the point. And 3, the whole system from a single word to a full report is built on a logical foundation. It's a system designed not to confuse you, but to be incredibly precise. And you know, that's the real power here. Once you realize that any complex subject is just a system with its own set of rules, it stops being so intimidating. You've just been handed a key to one of the most complex sounding codes out there. So the only question left is, what are you going to choose to decode next?